For in your time, we have the opportunity to move not only toward the rich society and the powerful society, but upward to the great society. The great society...
There was definitely a feeling that our generation had to change the world, and we had the potential to do it. We felt a calling, and in my case, it was a calling for public health. Over the last 50 years, working together, public health has had an impact on the world. We've been able to address the causes of disease, and millions of lives have been saved. The question is now, how will we work together over the next 50 years to improve the world? How will we leave a better place for our children and grandchildren? The Public Health Institute has been a major contributor to the gains in public health over the last 50 years. We've worked to improve the health, well-being, and equity in the U.S. and around the globe.
When I think about the Public Health Institute, I think about one of the most important organizations in civil society in America. It hits on all cylinders. It does research, particularly implementation research, so we know evidence-based ways in which to intervene.
And the unique part about PHI is that it takes those findings and then applies them to the field.
The leadership element is one of the hallmarks of the Public Health Institute.
The global health programs that you run, I think have made a very important contribution. And the work you've done around the social determinants, particularly the work you've done in California, I think has made a major difference.
They really are essential in really coming forward and providing lots of opportunities and lots of programs that really lead the way.
We live longer today than we did 50 years ago because of public health and because of the work that organizations like PHI have done over the last 50 years.
We've come so far, but our work is not nearly done. Today's public health challenges are more complex than they were 50 years ago. PHI will be a catalyst for bringing new partners to the table. We've already begun.
The public health of the future has to be about everyone coming to work with an understanding that they have a stake and a role to play in improving health in our communities.
We're bringing together transportation, law enforcement, education, and others to learn about how to solve some of the community's hardest, most difficult problems.
We work around the world in areas such as HIV/AIDS, reproductive health, child and maternal health, nutrition.
PHI mobilizes health professionals to limit climate change and promote healthy and climate-resilient communities.
We support health departments, hospitals, and community-based organizations across the country in using GIS mapping tools to identify hotspot populations most at risk.
Our work has contributed to improved health and rights for more than 3 million girls.
What makes me most hopeful about the future is my interactions with younger people that are really interested in global health. I know that the work will break their hearts, but they won't give up.
I think we're on the side of the angels. I think what we're trying to do is promote better health for the whole population in a fair way and actually create fairer societies. And that's a noble goal.
We've accomplished too much over the last 50 years to be daunted by the challenges facing us in the future. I am convinced that we will build a healthier world
Together.
Together.
Juntos.
Pamoja.
Together.
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 Ensemble.
Tayong lahat. Together.
Together.
We did not come to fear the future. We came here to shape it. I still believe we can do great things, and that here and now we will meet history's test.